So, hello everyone. Welcome to this Halloweeny WiNS seminar. Today we have our very own Francisca Ortiz giving the seminar talk. She's a postdoctoral scholar at the Millennium Institute for Care Research, which is based in Santiago de Chile. And she's a sociologist, has a master's degree from the Pontificia University. I don't know how to quite pronounce that, in Chile, and she did her PhD at the University of Manchester in the UK. And her research focuses on social support and care networks of the aging population, social gerontology, mixed methods, social network analysis, and gender inequalities in science. And I'm very excited to hear more about that from her today. So, Francisca, the stage is yours.
Thank you so much, Alice. And I love the hat, as everyone probably agree. So I'm going to present today some of the findings about my research right now. But so as everyone probably understand, when you send the abstract for the publicity and the diffusion of the talk, I was expecting to have some results about the network dynamics through time, but suddenly that is not going to happen today. What is going to happen is that I'm going to present a little bit about social support and care networks in general, the theoretical aspect, the conceptual aspect, but also the methodological approach that I'm using, which is very interrelated and is something that I very much would like to share with you. But also going to present some results in terms that they're more exploratory sense. And something that is super important for me, at least, is to say that this research is not only done by me, but it's also done by an amazing team of assistant researchers who are actually working in Chile. And they are the four of them that are mentioning there. So Trinidad, Natasha, Ignacia, and Natalia, they have been an amazing team for this work. So about care in America Latina, so care is a big concept, okay? We always hear this in the news. Sometimes we hear about this related with older people, which is actually the topic that I'm going to be talking today. But the main thing here is that in Latin America, we have one big issue that is actually that families are incapable of covering all the necessities of those groups who actually need some kind of care. And that's been a huge problem since, well, a lot of people mention that because woman tends to work, then this appears as an issue, but we know women still are the ones who actually take charge of the main care in houses. So it's like the whole thing is, there is a lot of factors that are in there, but the interesting part of it, or at least what I'm trying to find out, is about the network of care, because this is not only about one person caring about the other one, it's not about a diet, it's actually a big network of caregivers and care receivers. So I'm going to talk about the case study of Santiago of Chile. I would love to talk about the whole Chile, but as you see, it's very long and diverse, so I have to concentrate my research only in Santiago. So in this context, actually 24% of all the people who live in their homes has to depend from other, which is it's a huge number. And as a context, this is a neoliberal system pensions, which means that you have a 10% mandatory save from the first job. And this has been studied for a lot of people, to be honest. And you have some research that is pointing out that actually has this kind of system of pension has a negative impact in older people, because actually increased space inequality, older women are the most affected, because they have really big gaps in the trajectories because of maternity or other stuff, or they are more present in informal works. And the majority of the aging population actually has today less than the minimum salary as a pension, which is a huge problem. So the objectives of this research just to give you a very concrete lineup of what is this about. So this research tried to understand the care and support networks of older people in one specific community center in Santiago of Chile. So I said, okay, I'm going to only study the people who are going to this community center. And about this, I'm more interested about gender differences, about age differences, about the typology of networks that we could find between them. And also I would like to evaluate the relevance of time, maintaining, or actually maybe not maintaining, actually broken these kind of networks of all the people at some point of their lives. So that is something that I was hoping to present today, but definitely it's not going to happen, but hopefully in the future. So about theoretical framework, I'm a sociologist by training, so bear that in mind. I need to talk about this stuff because they are central about, from my research. And what happened is that I say, okay, I study social support networks in my PhD. Great, I know about that. I feel comfortable talking about that, at least a little bit. And then I'm going to move to the care support, care networks. And when I look into the literature, something happened that actually care and social support networks are super similar. It was super complicated to differentiate between both. And I found some studies who say that social support was something that affect into care, but other studies to say that care, it was something more general and actually affect social support. Then I read other studies saying that actually the difference, it was that social support, it was for persons with some, with no disability, but care was used for people with some disability. Okay, and then I went to other studies, and actually I found that a lot of studies measure it in the same way. So that was the tricky part. They use exact the same questions in their surveys to measuring this different concepts. So as I was trying to understand this, and it was very complicated, I tried to organize a little bit this information. And okay, the concept of care is very tricky. Is, as many researchers have been said already, is polysemic, it's full of paradoxes and ambivalences. I love this quotation about saying that care has many definitions as researchers, which is super true. And care is naturally difficult to define. There is a huge range of these definitions. So when I tried to organize the literature, I found that there are at least 3 patterns as a way to define it. First, I'm going to, yes. The first one is as a value to reach justice and equality. So is to understand this is like you're thinking that democracy without universal care is actually patriarchal and not equal. So it's very gender-based kind of approach to this. And this understand that any person is interdependent. So it's not that we need to care only for those who need. It's actually thinking that every human being needs to be cared in some point of their lives. So that's an amazing approach, an approach that is thinking about justice in general. The second one is more practical, we could say, because it's thinking about activities and relationships. So it's just a list or a summary of activities that a lot of people can measure really quickly. But that's also confusing because we found that also in social support. And then we have another approach, which is thinking about this, about care as a complex net of links or nodes, which is definitely more close to the network's perspective. But this one deals with, this one identifies that the network is actually activated to deal with illness or to deal with some problems that people have. So it's really specific moments in the lives of someone. So it's not something that you have in all your life, which is a little bit different than the approach in the first one. So what we could say, care is a value, is a relational concept, of course. We can think about it from a society, we can think about it from the approach of thinking society as a social interdependence way. We can think about it not only in terms of activity, but also in terms of emotional work, which is something that a lot of feminists work on it, relationship and specific actions. But also I would like to highlight that it's obviously complex, collective, multidimensional, multi-institutional arrangements. And actually it's different between care settings. And something that I found out, there is a lot of research about these care networks, but only and mostly in health settings, like only in hospitals or when someone is having a new illness and how they deal with that. So let's see social support. Actually, social support happens the same. And there is a lot of literature saying exactly the same. Like, oh yeah, well, the definition is very complicated and we have many different definitions to work on. But again, I'm going to try to organize this a little bit. So we have people saying it's a way to cope with difficulties. So it's the help that you actually receive to cope with everyday life. So if you have a problem, to whom do you call? The second one, would it be as a complement of social capital? Is a lot of people use it as a complement of this other notion, and they is very related with this sense of that you need resources from other people to keep going. And the final one, and the most interesting for me at least, is that it's also a source of stress and constraints in daily life. So it's not only such a good and positive thing, but it's also a source of constraint between relationships, because there are expectations between each other. And if you cannot deal with those expectations or be enough to actually cope with those expectations, that could be super stressful, especially when you have family relationships. So in this research, actually, I take an approach that is using both ideas, and it's not only taking social support as a positive thing, but it's also as a stressful thing. So that's why actually I measure many different dimensions, all the ones that you see in there. So economic, which is to whom you would like to, you can ask for money. Emotional, to whom will you share your problems or seek for some help with that problem. Advice, to whom will you ask advice, really specific one. Physical assistant, to whom maybe you will ask for some help to go to the supermarket, which is a very simple example, but also the example that I apply for all the people. Conversational, with whom you talk about these daily things, like how Elon Musk take Twitter. Positive interactions, to whom will you go to holidays, and negative interaction, to whom you have some tensions or difficulties in your daily life. So all the things are relevant for this research, because I was trying to clarify somehow this distinction between these two networks, social support from one side and care for the other one. And a very old distinction in the networks world that we have is this idea about available networks, which is the one that we have in our context. The perception networks, which is the one that we think actually is going to be something that we could ask for, and it's more cognitive. And also we have the actual or real networks. I don't like so much the idea of real networks, because obviously all of them are real, but just to make myself explain, just is the actual network, is what some people in the literature mention as real network, which is the network that you actually use in some point of your life. So it was very concrete. So what is the difference in here? I'm going to just keep the other ones, but in the actual network, what is important is that you ask, for example, to the person, okay, when was the last time that actually you have an episode related to your health? And the person mentioned that. And then you ask for the people who actually help you in that point. So it's a very concrete question. So that's why we can actually make the distinction between actual and the other ones. So what I'm proposing, at least until now, is this distinction between care and support networks. So care networks appear to be something more close to justice, about the idea of society, something more abstract. Because of that, it makes sense that actually care networks could be something about the available networks and about the perception of those networks. But in the other hand, support networks are more practical and are more concrete networks from their definitions, which is maybe the only differentiation that actually could find in the literature review. So that's what the distinction that I'm going to use. I'm going to try actually to check if that works or not in the results. So about the methodology, I'm doing a mixed method approach. I'm using this mixed method approach actually in all the stages of the research. This means that it's all in the data collection, but also it's in the data analysis, it's everywhere, to be honest. But it has a lot of focus on social network, obviously. So the two main instruments are interview with network-related questions, which were done in 3 different moments of the time, and with 1.5 months of difference between each other. And then in the last interview, we have like a second part of the interview, which was another in-depth interview, which was more about talking about the visualizations, because actually I have the opportunity to show all the people the visualization of their networks and say, hey, what do you think about this? This makes some sense for you, or is just, I don't know, garbage? And then I also asked about the notions of care and support and when they think about that. And all that obviously was all the field work actually was just done. So right now I'm in the cleaning data phase, which is not so fun, but yeah, I'm doing, it's going to be helpful in a couple of months, of course. So about the participants, I mentioned that I'm only studying one community center because it's really useful. You have the limitation, like the natural limitation of that center. And in that place, we have 57 people, plus 7, and from those 57, 7 are professionals, which I call, who are people who are actually there working. So they are physicians, psychiatrists, and I don't remember the other professions, but they are all health-related professions who are actually helping older people. And then we have 40 older women and 10 older men. In general, the first wave, I have 24% of missing data, which is not good always, but it's also something that I'm working on right now. But I have to say that in that 24% of missing data, I have some people who actually have some levels of dementia who were obviously taken out of the sample because the professionals in the center mentioned that to me and say, okay, with these people, we need to be careful. So they were out of the sample. About the amount of pension, just to give you an idea, they have 230,000 Chilean pesos, which is actually something like 260 euros approximately. That was the average of people, of all the people who were in this center. And you have some people that actually were having 128 euros per month, which is very low. And that was the whole money that actually they have. We have a lot of people with chronic disease, and the age range, it was very big. It was between 68 and 94 years old. So I asked about the perceived networks in each dimension, thinking about the perceived network as the care networks. The actual networks, we asked for each dimension. We also asked about the relationship between all the people and professionals, just to construct in a future, because in that way I can have actually a multi-level structure at some point. And then about other networks that they have in there, like friendship or caregiving networks. But I also ask, I really like ego networks and personal networks approach. So I try to ask them also for the people who actually care for them and support them outside the center. So it was not only about the people who were there, for whom actually I have the whole roster of people. So it was super easy because it was like, who from here give you emotional support? So it was like, okay, this one and this one. In this case, it was more open questions, like, okay, who from outside you will ask for money if you have a problem? And in the in-depth interviews, I'm going to skip just that because it's not something that we need to go in deep right now. And the results, I'm going to talk about two differences between, first, I'm going to talk about a little bit about the comparison between actual and perceived network and what the results tell us, and the ego network analysis as one first exploration of it. So the comparison between the actual and perceived networks, you can see the friendship network at your left, and at your right, you can see the caregiving network, and you see that I use the professional with a different colors, and they are the minority, so it's super easy to identify. There are always 7 points in a different color. And the ones that are super tiny are the ones that actually didn't answer in this wave, but they could also be nominated. So I need to report them in here. That's why actually they appear in here. So if you see a lot of isolated cases, because maybe nobody nominated them, so it's also an interesting result. So about the economic aspect, what is interesting is that a lot of people nominated in the perceived network, they nominated professionals. They immediately say, okay, the professionals are the people who I'm going to ask. But then in the action network, you can see there's almost nobody, which actually makes sense because probably if I'm going to ask money to someone, and if I did it in the past, probably I'm going to ask someone in my family or someone who is outside of this community center and not inside the community center. The emotional aspect, the difference between the perceived network and actual network is still there. We can see that it's not exactly the same network, but again, we see the professionals are super central in the left one. They are the main characters in the movie, of course. And we can see almost exactly the same pattern in the advice network. I have to say that the one who actually have more links in here is the psychiatrist, which is something that it makes sense because if you're asking advice, probably someone who you will ask is that person. But when we see the actual network, they didn't ask the people in the community center. They actually maybe asked people outside the center, but not the people inside of the community center. About physical assistance, we see actually something similar. Again, the professionals are starting here. And the conversational is a little bit more fun network because you have more links between all the people. And that makes sense because it's more interactional, it's than relationships. It's something more current about daily life and with whom you talk about daily. And also we can see some, well, 2 or 3 triads in there, and that's it. We still see a lot of isolated cases, which is something that I'm going to talk later on. And about positive interactions, the same as conversational. We see a little bit more connections between all the people. And the actual network is very different again. So we actually see only 4 groups, like, and if we can actually tell groups, because some of them are just dyad. And the negative interaction, which is maybe something positive, is that actually there are not so many negative interactions inside of the community center. So maybe we can think about this one as in a positive sense. So I did a QAP just to test what was the correlation between this dimension and how correlated was the perceived network with the actual network. And what was super interesting is that actually I didn't expect anything in here. I was like, okay, let's test this. And what was interesting is that actually we can find that the low correlations, which means that the most different networks are in advice, physical assistance, and positive interaction. But then we have a moderate interaction, moderate correlation in emotional and conversational, and in the economic, we have the highest correlation, which is also interesting, right? Because every time that we talk about social support networks or care networks, we only see the general idea, but we don't see each dimension differentiated, which is also a different approach, I think. So let's talk a little bit about the ego networks part, which is now outside the community center. So if we move outside, we saw that in community center, we have a lot of links mainly in the conversational and positive interactions, which are more things of daily life. But the ones that are more deep, for example, are not there, right? We didn't saw the connections. So we can say that actually maybe in the ego networks approach, we can find those connections, and we can say, okay, well, at least these people have someone to ask for help in the economical aspects or in whatever. And the interesting here is that about the gender aspects, we can see that these are two really good examples. That's why I'm using them. And I didn't have alter type relationships. So obviously all the ego networks are going to be stars like these ones. So you can see that, for example, in the case of Ramon, he actually, almost all the people in his support networks are men, and actually only 3 are women. But we see exactly the same in Francia, who is actually, there is a huge gender homophily aspect in here. I saw it in almost all the networks that actually you can see that their networks are mainly the same gender as the person who nominates these people. And if we look into a little bit deeper in this aspect, in the gender aspect, we can see that actually those differences are mainly in the positive interaction conversations. But when you see the type of support that they give to the person, that is where you are going to find a difference. So for example, women tend to be the responsible for physical assistance and emotional support almost in all the cases. So that's obviously keeping a very traditional way of looking at life and living life. So that's what was for the case of women. And then gender homophily was something that you saw a lot in the conversational and positive interactions dimensions. And then if you see the age, again, you see homophily. Okay, so the people who right now I'm showing you is the people who actually were with almost the same age as ego. So definitely they were the most close one and the people with whom they interact more in many different dimensions. It's not only in a couple of them. And the cases that they were not of the same age, it was because they were the granddaughter or the grandchildren in general, who were actually people who received support from the older people. So it was really, in these two cases that applies, in which the ones that are not showing here as highlighted, in the case of Fabian, Nicole, Felipe, Joaquin, and Javiera, they all were grandchildren. So it's like, okay, we can see a clear difference of the roles and a clear pattern in which you cannot see intergenerational relationships at all. And this not only happens in these two cases, actually happen in almost all of them. So these are all the ego networks that I have. One case is not there because actually it didn't have anybody. And that was a very complicated case to do the interviews because of all the emotional component of it. So, but this is the whole spectrum of them. We have 7 cases in which you can find between 0 and 4 authors, which are really minimum amount of people, and they usually don't give all the supports, all the dimension of it. Maybe they give 1 or 2 and that's it. So they are very tiny networks. Then we can see the majority of them here concentrating the second type of ego networks, which is people who actually mention between 5 and 10 alters. And you have a little bit more complex structures in the narrative, obviously not in here, but in the narrative of the story of those networks. And then you have the last ones who are more with a size of 11 or more alters. And what I found interesting from this is actually the reflection that we can create from that result, because it's really descriptive, actually, result, but it's super interesting in the sense that we have these 3 types of networks, right? We have the left one, which is really tiny, and then we are going to increase the amount of alters. And we can actually create the reflection, and it's something that it has been explored, but from other approach, that maybe into the left side, we can actually could be talking about a major risk of isolation of older people. And if you go to a little bit up to the right side, is less risks of isolation. And what I would like to point out here is that I'm not talking about loneliness, because loneliness is about the emotion and about how they feel. And I didn't ask that. So I'm actually talking about isolation, because maybe they are more isolated of society or other groups or other community activities. So maybe if we think about this in terms of public policies, maybe we need to think about this approach to actually identify people who could be in risk of more isolation. So let me draw some conclusions until now. I really like this idea of checking what happened in the theoretical frame or conceptual frame and what happened in the methodological decisions, because those are super embedded. And when we take decisions that are methodological, actually they have to have a correlate in the theoretical framework and in the other way around. So about the community centers, something that it was interesting is that actually when you look into the literature about social gerontology, you see that the community centers are a big thing and everybody loves them. But they are a space in which actually is supposed to be for all the people connect to other people. But in here, we see something different. We see that actually they are connecting and they have a lot of interactions, and that's really good. But they are interacting more with the professionals rather with the older people. So maybe we need to rethink that in those terms, in thinking that maybe we need to create spaces for all the people to interact more with all the people. So as I was saying, professionals have a more central role in emotional, advice, and physical assistance networks, while we have more connections and patterns in conversational, positive interactions, in the friendship networks and caregiver networks. So it's more, here we can find the difference between relationships and interactions. So maybe with professionals, they're creating more relationships, while with all the people, they are creating more interactions. And maybe we need to deal a little bit with that distinction. And something that it was really good to see is that there are not negative interaction scenes, which was a change, because actually I was expecting some negative interactions to explore in this research, because it's fun, that kind of literature. But if we think about it, it's a very positive aspect of this community center. And differences, there were fine differences between perceived and action networks. So we saw that definitely the action networks are way smaller than the perceived ones inside of the community center. There is this thing that they are more different when you are talking about the advice, when you're talking about physical assistance and about positive interaction. And I think that it needs more research in the future. So about public policies, which is something very relevant in my research, at least, I think the social impact of it is interesting to think about it. So I was mentioning already that promote create more instances to promote the creation of links between all the people inside the center. It could be something beneficial for them. We need to talk about isolation in the aging population and how that could be actually measured through networks. That's something that has been already done, but I found super interesting how you can actually compare this, and you can actually say maybe to people who actually take the decisions in governments or in organizations as this type of organizations. And you can say, well, maybe you need to identify the people who are in more risk of isolation. We need to think about more intergenerational relationships. That is a huge problem, and I have done more research about this in other aspects, or in other type of research from other perspectives. And Chile is a really, Chile is a very good example of not so many intergenerational relationships. And you can see that in this research. And the whole thing about gender for me is super relevant, and definitely we need to diversify those networks because there is some traditional roles that you can see in it. About some limitations, just to go in and to finish him. So some limitations, the challenges of getting answers in 3 ways are obvious for any person who has tried to make a longitudinal approach. They are always there. And I have to say that actually there was 1 month that it was extremely complicated because it was the month in which was the high peak of all sickness from winter in Chile. So definitely it was a bad month to do fieldwork, especially with all the people, because they were not attending so much into the community center as in other occasions. And obviously this is a case of study. So we have a lot of richness about the narratives, this kind of discussion and very deep approach to each concept, but we don't have any representative data. So next steps, I would love to compare what happened in the community center with the eco networks more closely. Like in a future, I have to make those in one analysis, hopefully, but I have no idea how to deal with that yet. So at some point I'm going to deal with that. Modeling this data, obviously, from a cross-sectional perspective and longitudinal perspective is my next step. Afterwards, I ended up cleaning all the data. And that's it. So thank you very much to everyone for hearing, for being here. And I'm going to just stop sharing. Yes, there it is. Thank you.
Thank you very much, Francisca. I'm super happy to have finally learned about what cool research you are doing. We have ample of time for questions. For if anybody wants to ask a question, just feel free to either raise your hand or type in the chat, and I'll call on you. And I'm going to start us off by asking about the last point or second to last point that you had on your slides just now, which was about connecting your findings for the ego networks to the networks that you have in the communitarian centers. And so first of all, just to understand this, so these communitarian centers, these are places that all people can go to hang out, or like, is it more like a healthcare center? Is it what's it
what
like?
Is it? Yes.
Yeah.
Yes, I always forgot to explain that at the beginning. Sorry, but it's a space which is available for the people in the same neighborhood, in the same district, and they can just register themselves for the whole year. So it's like almost a school for aging people. So they just go over there and have activities during the whole day. And they have things between the whole morning and sometimes lunch and sometimes afternoon. But it's always the same group. So actually I have another level that actually I can consider, because sometimes they have differentiation between days. So they not always go all the days of the same week. They go, for example, the group of Mondays, the group of Tuesday, the group. So actually I can create that other level, which hopefully I'm going to do soon.
Cool. So I was wondering whether the people that you asked in the Ego Network survey, whether those are the same people who you asked in the center, or whether this is a different set of people and how you got those Ego Networks. So how did you select the people for the Ego Network survey?
Yes, actually, I have to confess, I spent a lot of time asking things to other people. So it was a long interview because I asked first for their relationship inside of the community center, and then their relationships outside the community center. And there, with that second part, I construct the ego networks. So all
Okay,
the
so this is the
egos,
same set of people?
exactly. All egos are the same people who were interviewed in the first part. But it was clearly for them, like, okay, now I'm going to ask you about people outside the community center.
Okay.
And they were exactly the same questions, only to contextualize them, it was outside.
So the and I see Sneha has got her hand raised, but I'm slowly getting to the thing that I wanted to ask about, which is if those people are the same people, and you see in the communitarian center networks that you have a lot of isolated nodes, which kind of looked a bit bleak, but then you showed the ego networks and you see that a lot of people have networks that live outside of the communitarian center. So the people who make more connections in the communitarian center, are those the people who might be more isolated outside of the communitarian center, or are those the people who are also very well connected outside of the communitarian center?
Yeah, that's a really good question. I don't know. I'm going to check that. That's a really good thing. Yeah, now I'm actually curious about what happened in there, because maybe it could be a really good hypothesis that is that actually the people who are asking for help is not inside of the community center, it's actually outside of them because they're asking help for their families or whatever, which makes perfect sense because I'm not, that happened probably to everyone here, right? You are not going to ask to a colleague for everything, but maybe you are going to ask to your family or your close relatives or friends. Yeah, I would like to see what happened in there, but I'm going to check and let you know.
That's exciting. Do let me know. And I'm gonna hand over to Sneha now.
Hi, Francisca. Very nice
Hi.
talk. So I just had this question regarding this interactions, positive social network and the negative social network. That was really fascinating to me because I don't think of social support in terms of negative things. So I had two things. One thing is, do you also see some sort of symmetry in the networks? I mean, if let's say one person seeks out another a colleague or a family or a friend whenever they are in need, and do you also see the other person seeking them out? So is it like a mutual thing?
Yes. Okay.
Okay. And the other
no,
question that
yes.
I have, so sorry. So the other question is the lack of positive social support. Can you also consider this to be a type of negative social support in a way?
Yeah, I'm going to start with the last one. That's a really good question. Thank you so much for that. So about the last one, I will say what I read about negative interactions and how they measure it. I found that sometimes people, those when doesn't exist any positive interaction, maybe it's because it's a neutral kind of relationship. So I could also add positive interaction, negative interaction, and also neutral, which would be in the middle of it.
Mm-hmm.
And I think that would be my approach, at least, to do it. I don't think if you don't have a tie, it's negative. Yeah, it's just because maybe you don't talk about anything with the person, that's it. No. Yeah, but it's a fair point. And then the other one is about mutuality and reciprocity. And I found that super interesting because I didn't check in deep yet already that part, but it's something that interested me too much because in a lot of Latin American literature, we found that reciprocity is something that actually affects relationships and create tensions and creates negative interactions, but also you found that, for example, a family is not the people with whom you expect reciprocity, and actually you expect more reciprocity from friends or that kind of stuff. So I found that fascinating. And I think what I found, at least until now, what I can say to you, is that reciprocity, it was very, something very common to found in those interactions which were about conversational dimension, about positive interactions, and it was another one. No, I think those, and emotional it was also something that appears a lot, which also makes sense, because if you trust in someone to tell your problems, maybe you expect that the other person trusts you to tell their problems. So it creates this kind of reciprocity relationship. Yes, that's all what I kind of refer right now about that. But that's something that fascinates me, and hopefully I'm going to go deeper in that later. Yes, thank you.
Thank you. Thank you.
So we have a question from Alessio in the chat. It's a technical question about how you measure the correlation between networks. And Alessio, if you want to add something to that.
Yeah. I use QAP analysis. I don't know, Alessio, if you know that type of analysis. Quadratical. How is the translation? Any of you know the? I'm not seeing my. Oh yeah, I can write it out. QAP analysis. That is an analysis that measures. It replicates the same measurement a lot of times. I did it 10,000 times, I think. I remember it was really exaggerate from my side, but I did a lot of replications to see what happened in there. And I think it's a very good descriptive kind of measures that you can use easily. And we sometimes forgot about it. So sometimes I feel like in networks we make a lot of amazing and very fancy stuff, but sometimes it's really good to go to the classic measures, and this one is a very old one that you can find information. And if you want to know more about that one, you can actually send me an email. I'm happy to send you something about that one. Hope you hear me, because I saw that you said that you were in a noisy environment.
Do you know about the QAP analysis, how it compares if you have network of different sparsity? So is the QAP score going, or the QAP similarity correlation going to automatically be higher or lower if your networks are more sparse or more dense?
Yeah, I think actually it controls for that.
Okay.
So that's actually why I was interested in that one in particular, because I have a lot of isolated things. I have a very messy kind of networks. They are really not the network that you expect. But also for me, it's like, actually they are really, they are real networks, right? Because it's not something that like the perfect sample and the perfect kind of data that you could have. So as far as I understand, it's controlled by that. But that's a really good question. I'm not quite sure about the mathematical aspect of it, because I know that you would be more interested in that part, but I'm not quite
That's
sure.
what you have me for, right?
Okay. I know that obviously well, in the University of Manchester is Martin Everett, who is a mathematician, and probably he will be perfect to give you that answer, because he was the person who most defend that kind of measure all the time.
What's the name?
Martin Everett.
Martin Everett.
He wrote down the book of analysis of networks, analysis of social networks, which is right now available for R. But I think you use Python.
Yeah, I mean, like, you have to know many languages. I'm now working with a student who's more comfortable in R, so I have to learn the basics at least. But thank you. So if there are no further questions for now, then I would like to thank Francisca again. And
thank you.
I would like to thank everyone for being here.